This video is provided for the education of our patients so that you may become acquainted with the basic information regarding groin hernias. This includes the anatomy, approach to repair, and expected outcomes and potential risks of surgery. The goals of hernia surgery are to produce a lasting repair, meaning a low rate of recurrence, to provide an early return to work, and to render treatment in as cost-effective a manner as possible. To minimize the discomfort at the time of surgery and to make your surgical experience a positive one is the goal of everyone involved. Many patients wonder, what is a hernia? Most often the term hernia is used to describe abdominal wall hernias, although other types of herniation can occur. Most simply stated, a hernia is just a hole or a defect in the abdominal wall. The most common location for this to occur is in the groin, in an area known anatomically as the inguinal canal. This video will be concerned specifically with inguinal hernias. The inguinal canal is a naturally occurring weak area in the groin where the blood supply to the testicles and the spermatic duct run between the abdominal wall muscle layers. In women, there's a similar area where a suspensory ligament of the uterus runs, and it's also referred to as the inguinal canal. In general, it is felt that the key to achieving the low modern rates of recurrence after hernia repairs is due to use of the mesh or the prosthetic material. However, mesh materials are not used generally for children under the age of adolescence or before about junior high age. Next, I will discuss instructions regarding your preparation for surgery and what to expect on the day of surgery. You should eat and drink normally the evening before surgery. If you're having local anesthesia with sedation, you should not eat the day of surgery, but may have something to drink up to 2 hours before your scheduled time. Patients who will be put to sleep or have general anesthesia may not eat or drink after midnight the night before. All patients will need someone to drive them to and from the hospital. For reasons of cost effectiveness and safety, most patients are encouraged to have their surgery done under local anesthesia with gentle IV sedation. For young patients or patients with very large hernias, and occasionally for obese patients, general anesthesia will be needed. Your surgeon will discuss this issue with you further as needed. For either anesthetic technique, an IV will be started in your arm shortly after you arrive at the hospital. All patients are instructed to wash the area of surgery the night before and the morning of surgery with an antiseptic soap. Please do not shave ahead of time, as the preferred time to do any shaving of hair is in the operating room immediately before the surgical prep. The operation lasts between 45 minutes and an hour and a half, depending upon the complexity and the size of the hernia. The actual operating time for infants may be considerably less, but anesthesia time is correspondingly greater, so that roughly an hour is usually spent in the operating room for most infants and children, as well as for adults. After surgery, patients will be in the recovery room until they've demonstrated the ability to walk with minimal assistance, keep a few liquids down without nausea, and be close to normally alert. This time is longer for general anesthesia patients, but typically even local anesthesia patients will be kept under observation between 30 and 45 minutes at a minimum before discharge. Most male patients will be asked to demonstrate the ability to pass their urine before discharge, and all patients will be started on some oral pain medication before leaving the hospital. Recovery after surgery will be quite variable, but there are only a few absolute restrictions. For groin hernias repaired with a mesh technique, lifting and straining is restricted to a 10-pound limit for the first 10 days only. Patients are encouraged to be up and moving about at home from the first day, as the sooner gentle activities are resumed, the sooner the muscular soreness resolves. The fairly significant discomfort and pain of the first day or two typically will rapidly improve during the first week, so that most patients can stop taking prescription pain medication somewhere between the second and fifth postoperative day. All patients should avoid working around animals or machinery or driving motor vehicles while on prescription pain medicine. Return to work for patients with sedentary jobs, meaning those with non-physical occupations, can occur as soon as you can resume driving, meaning that you're off the prescription medication and you feel alert and comfortable enough to function normally throughout the entire workday. Usually this is about 1 week, but occasionally could be a few days more or a few days less. For patients engaged in heavy physical labor, it is recommended that activity be gradually increased according to your comfort level, starting on the 10th day. Not every activity will be comfortable, but it will be safe to start testing the limits of your tolerance to physical tasks. The variability will be greater as to the actual return to work date, but it is expected that the majority of patients will be able to resume their jobs by about 3 weeks. Children will usually resume their normal activity within 1 to 2 days and generally are only restricted by their own discomfort naturally. For children younger than school age, it is not necessary or practical to impose any additional artificial restrictions. It is important that all patients have a good understanding as to the potential complications of any operative procedure. Most common complications are usually not serious, and fortunately serious complications are not common, but may still occur with inguinal hernia repair. The most common side effects of hernia surgery are bleeding, bruising, and swelling, which all occur to some degree and almost always resolve over time. Bruising is the most variable and can sometimes be quite dramatic in appearance, especially in men, but almost always resolves with time and only occasionally is associated with any significant bleeding. Serious bleeding is rare, but can occur. It is very unusual for serious bleeding to occur after discharge from the hospital, but if active bleeding from a wound is observed, you should contact your surgeon immediately. The surgical scar will swell and form a firm lump of scar tissue, which is expected and will require 6 to 8 weeks to resolve completely. This is normal and expected. Infection is fortunately uncommon in hernia surgery, occurring well under 1% of the time, but any surgical wound can develop infection for various reasons. Fortunately, not all infections will involve the mesh that was used and can usually be treated. If your wound develops signs of infection, which are warmth associated with redness and increased swelling of the wound beyond what you saw the first day or two, then you should contact or see your surgeon soon. Reoccurrence of the hernia is now an uncommon complication, occurring less than 1% of the time with mesh techniques. For any self-pay patient who underwent initial repair at the Mercy Hernia Center, a recurrence will be repaired again without payment of the surgeon's fee, as long as you have followed all the postoperative instructions and returned any follow-up information that we gave you. Facility fees will still need to be paid to the hospital for treatment of a recurrence, however. Because there are sensory nerves in the area of the inguinal canal, some numbness of the skin in the upper leg, lower abdomen, or groin area is not uncommon. Occasionally, chronic nerve pain can result from surgery in this area, but this is rare and often resolves spontaneously, although very slowly over time. In men, the spermatic cord and the blood supply to the testicles can also be injured, although in adult males, these types of problems are extremely rare for first-time hernia repairs. However, atrophy, or loss of a testicle, can result, although usually this is not considered to be much of a risk except in repair of recurrent hernias for adults. In infants, however, problems with the blood supply to the testicle or injury to the spermatic duct are more common due to the very small size of these structures. This is the main unique surgical risk for pediatric patients who are at a greater risk for these types of problems than adults, but still these types of injuries occur fairly infrequently. In summary, all personnel at the Mercy Hernia Center will do their utmost to make your experience a positive one. If you have any questions, please feel free to ask your surgeon or any of the personnel that you come in contact with. Thank you.